Good afternoon to the men and women of the Missouri State Senate. My name is Mia Quinn, and today my team members and I have come to speak with you all on behalf of Memorial Community Hospital. We will be going over Memorial Community Hospital's vision and mission statement, SMART objectives, services and strengths, financial needs, and finally the specific leadership theories employed by MCH administrators. Memorial Community Hospital, which opened in 1970, is located in the small, peaceful town of Keene, Missouri. The city of Keene is home to only 6,128 individuals and is located 50 miles from the closest urban city. The hospital has 45 beds and offers services in acute care, emergency care, 2 rural health clinics located in the county, home health services, diagnostic testing, surgical services, hospice care, and therapy services. MCH's vision statement reads that Memorial Community Hospital will foster an environment which provides protection, uniqueness, and creativity to ensure that patients are provided with the best quality of care. Our hospital's mission is to provide outstanding care to underdeserved and uninsured patients, create a contagious and friendly hospital environment, and utilize unique resources in order to provide quality care to our patients. We have created SMART objectives in order to create, track, and accomplish our long-term goals for the hospital, which are as followed. Because our hospital values our patients' health, on June 1st, 2023, MCH will begin creating an educational program that will be available at the hospital and on the hospital website to inform patients about the early warning signs of kidney disease and chronic pulmonary disease to reduce secondary visits from 21% to 15%. By February 2023, MCH website will have accessible information available for patients that can improve health literacy skills, provide credible information to current issues in healthcare, and basic anatomy and science that includes visuals for easier processing. The hospital will provide 68% of outside referrals within a 30-mile radius, such as therapeutic and rehabilitation facilities, in order to decrease the length of hospital stays for recovering patients, allowing more available beds for incoming patients.
Thank you, Mia. My name is Michael Sochet, and I'm here to discuss some of the services that we offer at MCH and what makes our tight-knit community so special. As Mia mentioned, we mainly offer services in acute and emergency care, as well as labor and delivery services. We have 2 rural health clinics in the county, and we also offer home health services, including hospice care. We offer diagnostic testing and laboratory services on-site as well. We employ 130 full-time staff members, including 8 physicians, 1 surgeon, and 1 physician assistant. Patients receive general surgical services here. However, we still have to refer out for specialized surgeries. It is our allegiance to continue emphasizing our mission and vision at MCH and take advantage of the resources we do have available to us. MCH has an average of 7,300 outpatient visits each year, with an average 147 emergency room visits and 180 admissions each month, keeping our hospital full. This means it is crucial that we are fully staffed at all times. Safety is our highest priority for both our patients and staff. In an effort to keep our community protected from disease, MCH has implemented a vaccination policy that requires every staff member to receive yearly vaccinations against COVID-19 and influenza. Here at MCH, we value our patients as people who are seeking direction, quality healthcare, and advice. We put our patients' needs first and place a strong emphasis on fostering their well-being along with their families. As healthcare professionals, we have a duty to protect our surrounding population and the community in which they reside. This includes serving as a vehicle in both disease and infection control and prevention. Healthcare workers unite under one overarching goal: to provide quality patient treatment and preventative care. Requiring our employees to receive both vaccinations allows better protection from contracting these diseases, in turn improving the proficiency of the hospital by having more staff available to see and treat our patients every day.
Hello everyone, my name is Emma Retcher, and today I am here with my team to discuss the dire need for funding to ensure that Memorial Community Hospital remains open to serve the Keene community. MHC is proud to provide a wide array of medical services to those who are uninsured, underinsured, and treat those with chronic health conditions, but this does not come without its challenges. Recently, we cut our expenses by 10%, which was difficult, but ultimately the best decision to ensure that we had a reasonable budget. But to keep MHC functioning, it is imperative that we receive that additional funding. Right now in the United States, those in rural areas such as Keene are experiencing a healthcare crisis due to the frequent closing of healthcare facilities, and this can be deadly. Those in rural areas are likely to experience poorer health and suffer from chronic illnesses, and more likely to be without insurance. What do you do in an emergency if the closest emergency department is 45 minutes away, or there are not enough available beds at the hospital to be able to admit you? The ability to access healthcare can be the difference between life or death. Additional funding would ensure that MHC is able to keep our doors open for our current and future patients. Specifically, the funding would go to increasing the number of staff at the hospital to give us the ability to put in more beds, give pay increases, and continue providing care to the underinsured. Denying additional funding could mean more budget cuts for MHC, which may compromise the ability for us to provide that excellent care that we are known for. This would mean that the care that Keene residents would need would be inaccessible and may discourage them from seeking out health care. Regardless of an ability to pay or insurance status, you will be seen and provided with excellent care, and we will be accessible to your every need. Help us keep MHC open, accessible, and affordable to the residents of Keene. Thank you.
Thank you for kindly inviting Mia, Emma, Michael, and I to present Memorial Community Hospital's values and desires here in Keene, Missouri. My name is Elise Schwartz, and I want to display the specific leadership theory that we exercise regularly here as administrators at MCH. Following a leadership theory within the hospital provides room for goal setting and achieving shared mindsets and greater communication. Additionally, doing so allows for greater collaboration within teams, leading to the greatest level of care for each individual patient. Residents describe Keene as family and community-oriented and peaceful. That is why we want to utilize Kouzes and Posner's leadership theory framework that was developed in 1995. They state that leadership is successful only if a shared vision can be communicated to followers that change their values. Using this theory, employees at the hospital can hopefully feel inspired to bring in the same feeling of familiarity of the community inside of the hospital. This theory focuses on eliminating institutionalism, so we constantly reiterate our mission and vision, having pride in the care that we give to each patient we come across, treating each patient as their own individual, and being one of a kind. Kouzes and Posner developed this theory with 5 constructs: challenging the process, inspiring a shared vision, enabling others to act, modeling the way, and encouraging the heart. We want our leaders in this hospital to ignite their subordinates to guide them through togetherness. Because of the ruralness of Keene, we stress that certain policies and structures in other hospitals must be unlearned to form new structures. So aside from implementing new ideas, we also want to be sure that we identify the flaws that affect the flow of the hospital and the quality of care that we provide. Going back to our vision of fostering an environment that is protective, we must remember the socioeconomic limitations that are present, such as older age residents, low education and income, which all lead to unhealthy lifestyles, majority of the time. So we need to overly communicate about what we are changing to make sure that our vision matches the residents and their needs. Leaders here at MCH are also required to allow their subordinates to act by offering them opportunities to present their opinions, to be heard just as much as their leader does. In modeling the way from Kouzes and Posner's theory, they accentuate do as I do, meaning to live by example that others seek. We want our leaders here to be inspiring to the rest of staff, to create shared values and feelings about the hospital system. Even if something does not work out, modeling purpose through behavior can still make an impact on the flow of the hospital. Finally, they end the leadership style with the simplicity of emotional connections, showing empathy, sympathy, and passion as a leader encourages subordinates to continue becoming better for each other and the patient that come to us. Our leaders are expected to show loyalty and respect just as much as their subordinates do to them, and this creates an environment for acknowledgement of each employee, leaving room for valued criticism followed by improvement. MCH tries our best to feel like one big family inside of the hospital, just as the residents do outside of it. By organizing a leadership style like this, we hope that it is shown in the quality of care we give to the patients. All of us would like to thank you so much for inviting us here to the state capitol and for taking the time to speak with us today. Thank you.